going to ask everybody to take their seats so we can get started.
Okay. We will.
Yeah, no problem. Yes, good to see you.
I want to thank everybody being here for our response component meeting. A couple of quick kind of housekeeping items. We've got, I know a couple of members. I know Chris Patterson and Greg Thompson are both participating remotely, and I believe Senator Malloy is also on remotely. As we go through the day, I'm going to ask just for the benefit of, we've got numerous people on. I apologize. Director Elzey's on, Jamie Suber is on from DO, and then Representative Weeks and Representative Pope. As we speak, because we have people online, whenever you speak, if you could say your name, because sometimes they may not be able to see you, and so it's beneficial for those who aren't with us in person, before you speak, if you just say your name. There are two people, of course, beside me who don't need to introduce themselves, but for the rest of us. And then also speak into the mic. They've all been sanitized, but so that people can hear you when you're speaking, and so it's clear on the other end. Before we kind of kick off in earnest, Helen, I'm going to turn it over to the governor. First, I want to say that thank you. Your leadership along the way in putting this group together, Governor, I think is beyond reproach. What we've seen is people addressing real issues that affect real people, that don't affect some theoretical group of people out there, but real South Carolinians, real businesses. And so you identifying this group of people to help you as we walk through these issues, I think it goes without saying that I will say, as a South Carolinian, as a husband and a father, thank you for what you're doing, and I appreciate your leadership. And so I'll turn it over to you, Governor.
Thank you. I'll be very brief. Well, a part of putting together a good team is having people willing to be on it and having the talent that's willing to stand up and get this done. Just 10 seconds, I want to thank you again. The work that this group is doing, this part of the group and the rest of the group is extraordinary. I know it's taking a lot of time. It's taking you away from other things, but I know the people of South Carolina appreciate it very much. And we're doing things the right way. We've known that. We went in with a very deliberate way in our restrictions, and we're coming out always with the safety of the people in mind. And our success has been recognized by none other than Dr. Fauci. The other day said South Carolina was a model, and he wished that he could clone us. So that's because of what we're doing here, and I thank you on behalf of the people, and let's get to work.
Thank you, Governor. And I will, Lieutenant Governor, we always get some leadership remarks from you. If you wouldn't mind, some. I know I'm putting you on the spot,
No.
so.
Well, James, I just want to echo something you've said and thank the governor. It's such an honor to work alongside of him as his second, and we should all be proud. Not only did Dr. Fauci talk about the excellent leadership here in South Carolina and the plans that we're putting together as we had to halt operation and now coming out of it. But there was a lot of recognition on Fox News this morning from leadership, national leadership. Tim Scott, very proud to be a senator here in South Carolina, and was praising the governor and his work and the work of this group. So thank you so much for bringing your time and your talent here. It's being recognized, and so I hope it makes you feel proud and makes you feel like stepping away from your businesses and your hectic schedules was well worth it. Thank you again.
Thank you, Lieutenant Governor. I'll turn it over to Helen Hill, who is the chair of our response committee, who was by the way, in front of the U.S. Senate yesterday testifying. I mean, from the U.S. Senate back to South Carolina. I mean, how about that?
Thank you, Mr. Chairman. I'm Helen Hill, and I did want to, before I turn it over to Jennifer to talk about our outstanding committee members, I did want to thank each of you because the message that this group carried to Senator Graham certainly made a difference. Ted, your survey that you did of small business and all businesses, I guess, in South Carolina really made an impact. So yesterday in front of the Senate Judiciary Committee, I testified about the need to protect our businesses with something that came from this very group, limited, temporary, and put in place as soon as possible. And it was really talking about the things that we had talked about, which is those health and safety guidelines, and those businesses that are acting in good faith deserve some temporary protection specifically for COVID-19. And so I want to thank you. It's interesting, it came right from this group right to the United States Senate. So it was a very good day. Senator Graham did a fabulous job. I wish I could say that the mood at the beginning of the hearing had, by the end, it had kind of waned back to sort of Democrat-Republican thing. But at the beginning, it was very strong. So with that, it did remind me, Governor, one more time, how blessed we are to be in a state where even when we have differing views, we always agree to disagree agreeably. And that's one special thing about the hospitality in South Carolina. So thank you for everything you're doing. Ms. Jennifer?
Good afternoon. Wonderful to be with all of you again today, and thank you to those of you who are joining us virtually. I know this has been fast and furious with lots of emails and requests for assistance and your feedback on things. So couldn't be more proud to work with you all. And I think it's important. I know James recognized several people who are joining us virtually, but I do want to take a minute and recognize the people who are here in person because you all have really stepped up. So Rebecca Leach with the Retail Association, she's here with us today. Director Ray Farmer, Department of Insurance, thank you. Frank Rainwater is here, thank you. John Dirch couldn't be here today.
He's back.
Is he? Oh.
He's back.
That's right, he was having printer problems. We already mentioned Greg Thompson is joining us virtually. Commissioner Weathers, he's on his way, but Clint Leach is here from Department of Ag. Chris Patterson is joining us from Summit Filtration virtually. Dwayne Parrish over here to my left. Sarah Hazard with the Manufacturers Alliance is here. Of course, Helen Hill. Lou Kennedy with Nephron Pharmaceuticals is here, joined by her colleague Rob Godfrey. Ted Pitts with the South Carolina Chamber of Commerce. Henry Swink with McCall Farms is to my right. Bobby Williams to his right with Lizard's Thicket. John Winarchek with Zeus Industries. I believe we've got Angel Malone with the Department of Ed joining us virtually as well. And then let's see, we do have a special guest who will speak to you a little bit later, Mike Leach with the Department of Social Services. Did I miss anybody from our committee? We do have a few folks, special guests that will speak earlier, and they will be introduced during their section. So we'll catch some of you who I didn't introduce individually then. And so now I want to turn it over to Dwayne Parrish with Parks, Recreation, and Tourism as we open our first agenda item, which is to discuss a few more business reopenings.
Thank you, Jennifer. If you'll remember from our last meeting, we talked about attractions, and we sent out we actually had it in front of, it is in front of you now in print. It's called Guidelines and Resources for Reopening and Operating Attractions. I sort of went through some of the highlights of that at our last meeting. It has had some refinements and changes to it as it's gone through. This category, as you can imagine, with attractions, there are a number of things in here, subgroups, what I would call them. Everything from a miniature golf course in Myrtle Beach all the way up to 400-plus acres of Carowinds at our border with North Carolina, and everything in between, museums, aquariums, zoos, and the like. But we've come up with the guidelines, quite frankly, that are sort of would apply to everyone in here in regard to how to operate, things that should be in place and the like that you've seen in some of the other things in regard to hotels and restaurants. The hotel part you will see later today. But what I do want to emphasize is that each individual attraction will have its own plan, if you will, because there's such a variation in these, unlike the restaurants. There is an individual plan for each one that would have its own things in place to make people feel safe. And I want to put a little bit of some of what I'm talking about up on the screen, if you don't mind, Zach, if you want to put. So this is Broadway go-kart races. I just want to show you some of the things in here that are on place on the screen in front of you. This is just one, he is not open, but what he has in place here, you can see the footprints on the right. Those are 6 feet apart on the floor where for people to stand. You can see hand sanitizing stations in place there on the screen on the left. You can see sort of the separation and the signage here of what's in place. Again, the footprints on the floor of 6 feet apart. And again, hand sanitizers in place for people to use while they're waiting in line, or at least in this place waiting to get on a ride. And if you would, bear with me, this is a very short, it's I think around a minute long video that they've done and some of the other tracks have done. I'd like for you to watch for just a minute. This is for, again, for the same location.
Hi, I am Christina here at Broadway Grand Prix and would like to take this time to address our concerns and preventative measures associated with the novel coronavirus. As part of our mission at Broadway Grand Prix, we are committed to providing a safe, fun, and clean environment for all of our... Hi, I am Christina here at Broadway Grand Prix and would like to take this time to address our concerns and preventative measures associated with the novel coronavirus. As part of our mission at Broadway Grand Prix, we are committed to providing a safe, fun, and clean environment for all of our visiting guests and employees while delivering a memorable entertainment experience. Broadway Grand Prix has implemented preventative measures as recommended by the CDC, as well as our own health and hygiene protocols, as we intend to open our doors once again to our guests. For more information, please visit BroadwayGrandPrix.com. On behalf of Broadway Grand Prix, our family cannot wait to see your family again.
So I just wanted to show you that as an example of what some of them are doing on their own plans, making people feel safe again. We've discussed that in previous meetings. That's out there, and I'm confident now that each attraction will have its own plan based in large part on the basis of our guidelines that we've discussed in a previous meeting and that you have before you now. And then the other attachment, it's a one-page attachment you have at your seat that shows phase 1 openings of individual experience attractions. It's up on the screen as well. I'm not going to go through each one, but as they're appropriately called individual experience attractions, just like if you imagine miniature golf, typically there's not more than one group of people, typically a family on one hole at a time. So there's sort of natural social distancing in a lot of those places. We also have, the reason it's called individuals, not necessarily an individual person, but an individual group, which can be a family unit or whatever the case may be. But I think all these folks and these categories we went through on here, as I mentioned, there are many subcategories within attractions, but I firmly believe that these that you have before you are ready to open. They have their own individual plan in place. A lot of these are along the coast, but you'll find some of these also as well in the Midlands and the upstate as well. But I open that up for sort of any questions regarding attractions, regarding this list of these phase 1s that are ready, and I sort of put that out there before you, and any other comments or concerns about the guidelines for attractions.
Dwayne, this is James. I'm gonna ask a few questions. So, as I understand it, you've kind of given us the guidance on attractions, and it now appears that you're looking at kind of a phase 1, which is this individual piece. Is phase 2 like a larger group?
I think, yeah, exactly.
Can you explain if they're in 3 groupings what they are?
Sure. I think they're more or less just kind of in 2 groupings.
Okay.
I think phase 2 is, think of large zoos, aquariums, Carowinds, for example, where you have large crowds in place. I don't think they're quite ready time-wise, but they're getting close. They need more time to prepare than these smaller ones that I have on here, but they're all working on their individual plans now, a lot of which is based on, as I mentioned earlier, our plan that we've got here, but each individualized to their own location. But phase 2 would be what I would call mid to larger size, where groups gather quite a bit, a little bit different needs for them to address the social distancing.
The congregate kind of setting?
Exactly.
Now, you'd mentioned that they would have, obviously, what is the way that we can disseminate the guidance to them? How do we, because y'all have done a great job between y'all and DHEC and Commerce and LLR with the recommendations and recommended guidance to follow. How do you push this out to them so that they can say, hey, I've got what I need to be able to, should that decision be made that they're ready to go?
Sure, several ways. One, a lot of this is already circulated organically, just amongst, because we had a lot of participation from these attractions. Secondly, we'd post this on Accelerate SC's website, where it'd be there for all to see. And thirdly, it'd be on Commerce's COVID-19 website for businesses to look at as guidance for recommendations for guidance.
Okay. Have you gotten any feedback from them with respect to any kind of, I don't want to use the term restriction, but where they're looking at a percentage of their normal, not occupants, but people who would, like, let's say you normally can have 20 go-karts on the track, but are they saying, hey, we're going to limit some of our numbers there so that we can make sure that we're doing,
Yes, sir.
kind of meeting the protocols?
From the smaller ones that I've got on this list right here, not so much because they are, as I mentioned earlier, more individual experiences. However, in the larger ones like the zoos, the aquariums, Carowinds, water parks, yes, they are. For example, the swimming pool that came out was 20% of, I believe I'm going off memory, was 20% of normal capacity. That would apply to a water park as well. In regard to Carowinds, zoos, aquariums, and museums, there would be a limited number of people. It would be less than normal capacity. They're still working through some of that, which is why I mentioned they need a little bit more time. But I think they'll be ready pretty soon.
Okay. And I'm going to look over to Ms. Hill real quick and ask, and then John, I'll get you. From just a tourism, and I guess I could ask you this, Dwayne, but I'm going to ask Helen.
That's okay. She's
Yeah, I'm going to, but from a tourism perspective, talk about what these businesses, the impact they have with respect to how we try to get our tourism industry moving forward. Can you talk through that briefly?
Well, the first most important thing that we're doing is we're doing this very slowly with Dwayne's crawl, walk, run scenario to make people feel safe, because no one's going to travel, right, until they know that they can come here and be safe. And having these attractions open is critical. I will tell you that Dwayne and I have been so thrilled at the ingenuity of our attractions. And we all know that it's those businesses, those small businesses, and many times that make South Carolina special, the reason people actually want to come here and give us our unique character. And I think we've been really thrilled at how they have embraced it and have been really willing to work with us in every possible way, because they're desperate to get our visitors back.
Okay.
Yeah, and I'll just echo that, particularly along the coast, and to think of the Grand Strand and Myrtle Beach and that sort of surrounding area of coastline, attractions are a big part of the tourism product there. And so it's sort of critical to help them get back on their feet that these start to open back up. And I foresee in the next response group meeting coming back to you with what you mentioned as phase 2 for the rest of the attractions.
And Mr. Chairman, I'm so sorry, the first thing I didn't say is putting people back to work. People are so excited to come back to work. Today, the Halls staff at the Halls in Columbia, they were so excited about tonight. It's great to see that energy back in our state.
Great. John, did you have a question?
Yes.
Or a comment?
This is John Winarchik. Dwayne, my question for you is, the DHEC has done a phenomenal job of putting together a large team of contact trackers, to identify close contacts if and when there's an outbreak of COVID virus at a business establishment or an entertainment venue. Do your guidelines provide for that? I mean, in a smaller setting, we've been careful to, like in opening up indoor dining, we're recommending like by reservation only. And the same thing with close contact businesses. It's basically a reservation, one service person on one customer. In a larger setting, like an amusement park, you're going to have a lot of people, in a given area. And even if you socially distance, every once in a while you're going to miss. Are you looking at it from the standpoint of lending assistance to the contact tracers so that when they show up, you will have a listing of or a fair amount of data as to who was present? So that they
Sure.
know?
Well, let me address a couple of those things. One, so DHEC went through this plan. They were participating along the way, and they've been through this attractions plan I have now. And there's on the last page, you'll see several places, links to different places on their website, as well as the CDC's in regard to that. In regard to specific contact tracing, yeah, I think every attraction will cooperate in trying to find, okay, who did this person come in contact? But just like going to a restaurant or going to anywhere else, or for that matter, walking along the beach, there's always that possibility that you walk by someone, you have no idea who they are. Obviously, that's always out there. But, you know, the attractions today, because most people pay by credit cards, they have records of who went in and who did, and who came through the gates, if you will.
Okay. All right, thank you.
And I think, and as you said, I mean, you're looking at this not being as large of a, what I'm calling a congregate type setting as, and this attraction is different than a large congregate setting like a Carowinds or a large sporting event. I'll just say a college football game.
Sure,
It's just
yeah.
different. It's just different.
Sure,
We're
yeah,
talking
that-
about something that's different.
Sure, yeah, exactly. This is a smaller group, and then in regard to the larger ones, which John mentioned about, like, in, let's say, an amusement park or a zoo where there are large congregates of people, they'll have measures in place, much like you saw in the video there and in the pictures, to keep that social distancing in place. And I think much like a lot of businesses, it's imperative that that business keep social distancing in place. As a manager, you have to monitor that, just like you monitor behavior in any business. As a former hotelier, you know, you have to keep the lobby clean. You got to keep people in line. People have to sort of, if they don't self-monitor, managers and owners have to step in to make sure that happens. Because if it doesn't, then that particularly with today's social media, that word gets out pretty quickly and people won't come back. So I'm confident that management and ownership of these different places will make sure that happens.
Lieutenant Governor, I think you had a question.
You know, I just want to add that I think we should feel extremely proud of what our business owners are doing. I said, Mr. Schwank said it great a few meetings ago. I mean, here they took the bull by the horns. They've set up their facility to make sure that people are distanced apart. They did that at a time when they weren't even open. They put up plexiglass. And I think that's a great testament to just how much everybody is all in on this to make sure that we can successfully open up and keep our customers safe. Because as a business owner, we're nothing without our customers. We're nothing without our employees. So first and foremost, I think this is a great testament to how well our businesses are doing rolling out of this to keep those things first and foremost in their mind.
Sam,
Other questions?
I think we're good. We can move to the next one. Dwayne, you have another one?
Yeah, I do have two more briefly. So one, I just want to, we are presently studying, we've got a couple of different plans. One you see in front of you is called Best Practices Guidelines for Athletic Fields. We've got a couple of them, one from the South Carolina Parks and Recreation Association, which is this, and then a second we'll go through. So in our next response group meeting, we'll have a final plan for athletic fields along the guidelines as well. And then lastly, I wanted to introduce Bill Ellen, who's the head of Experience Columbia, as well as he's part of John Durst's executive committee with the South Carolina Restaurant Lodging Association, to talk a little bit, just briefly, about our hotel plan. You've heard me mention it in previous meetings. It is in the handout in your folder like this. Bill, if you want to kind of step up to the microphone up here and kind of walk folks through it. This same group that worked on the restaurant guidelines, their resiliency task force with the South Carolina Restaurant Lodging Association had worked on this on the hotel side, which are primarily swimming pools, meeting space, spas, and fitness centers within the hotel. So Bill will kind of highlight some of those things in his report.
Thank you, Director Parrish. Governor McMaster, Mr. Chairman, and members of the committee, I'm honored to be here today to present to you a highlighted version of recommendations in a document that was prepared by tourism industry leaders from across our state, both from the public and the private sector. I'll begin in the lobby and common areas of our hotels. The recommendations are that entrance doors that do not open or close automatically should consider having a door attendant. Furniture in the lobby should be arranged to incorporate social distancing guidelines. Touchless hand sanitizer stations should be made available throughout the property. Frequent disinfection of all high-touch areas such as door handles, elevator buttons, handrails, telephones, and remote controls should be exercised. Fitness centers should be closed multiple times during each day for a deep cleaning and limit on the number of guests permitted, allowing for appropriate social distancing. As we move to the front desk area, plexiglass or similar protective barrier should be placed between the front desk agent and the customer. Key cards should be sanitized and discarded after each use. All guests are to be asked to fill out a declaration form detailing their recent travels. Reservation agents should be trained to ask guests about their health and travel and exposure to COVID-19 cases before booking a room. Self-parking options should be emphasized. For those hotels that require valet parking, we require that the disinfecting of contact points within the vehicle is required. As we move into housekeeping, which is certainly a vital area of the hotel that's going to need to be well trained in order to make guests comfortable with their safety, we're asking enhanced cleaning standards throughout the hotel, including guest rooms, meeting spaces, common areas, and back of house spaces. Cleaning products that are EPA approved for use against bacteria, viruses, and other pathogens, including COVID-19. Housekeeping shall not enter a guest room during a stay unless specifically requested or approved by the guest. A room should be left vacant for 24 hours after a guest checks out. During that time, it should be thoroughly cleaned and disinfected. Disinfecting wipes will be placed in each guest room. All items from mini bars will be removed. There will be no room service for dining or housekeeping. Linens, towels, laundry shall be washed in accordance with CDC guidelines. Dirty linen shall be bagged in the guest room to eliminate excess contact while being transported to the laundry facility. In the case or in the event of a presumptive case of COVID-19, the affected guest room shall be removed from service and quarantined for a minimum of 96 hours. The guest room shall not be returned to service until undergoing an enhanced cleaning and disinfecting procedures. As we move to food and beverage areas within the hotel, all hotel operations with a DHEC retail food establishment permit are required to meet the minimum education and training standards outlined in DHEC Regulation 61-25. Tables are to be spaced both indoors and outdoors at least 6 feet apart. Buffets and self-service stations, staff should dispense food from buffets or discontinue this service. Sneeze and cough screens shall be present at all food displays and service areas. In self-service seating inside restaurants, signage should be placed on tables or booths which are not to be occupied so that proper social distancing can be maintained. Signage should be posted in a publicly prominent place as well as on the website to stress the commitment to food safety, staff safety training, steps that you're taking to go above and beyond, customer safety, and customer responsibility. Meeting and banquet space, as we're in today. Maintain social distancing to keep attendees at least 6 feet apart. Registration areas should have markings on the floor to show guests where to stand for appropriate distancing. One-way entrance and exits into the meeting rooms are encouraged. Multiple hand sanitizing stations should be placed throughout the room. Microphones or on stands or handheld should be discouraged or cleaned after each speaker has used it. Got that? A maximum of 10 people per 500 square feet with a maximum of 250 people in a room. If we move to employees within the hotel, masks and gloves will be made available to all hotel associates, and they should be strongly encouraged to wear masks at all times. Training for all employees on how to respond swiftly to any presumed case of COVID-19 on the property and report them to management should be trained to do so. Each staff member will have his or her temperature taken before their shift, and there will be ongoing interaction with staff on their health status and the health of anyone with whom they may be in close contact with. Employees who notice a coworker or a guest exhibiting symptoms of COVID-19 should immediately contact the manager. Employees to be tested for COVID-19 prior to returning to work. There should be customer safety focus and training so that there is a plan ahead of time for a circumstance needed to expedite a guest exit from your hotel. You must be prepared to put guests in touch with medical resources. So staff and front desk need to be made aware of what the health and emergency availabilities are. Many of our hotels have swimming pools. The recommendation is should only allow 20% of normal occupancy or 5 people per 1,000 feet of pool and deck surface. Person-to-person interaction and activities between members of separate households should be limited. Commonly used surfaces such as bathrooms, doors, handrails, ladders, gates, lawn chairs, drinking water fountains, picnic tables, etc., should be cleaned and disinfected between each use. Hand sanitizers should be provided for use by all staff and visitors. Signs and examples of 6-foot areas related to social distancing should be posted. And all shareable equipment such as kickboards or floats should be removed from service. And obviously, pools should follow the CD guidelines regarding cleaning and disinfecting. This concludes my highlighted version of this report that was prepared by, as I said, tourism industry leaders across the state. So, Governor McMaster, it is my pleasure to, on behalf of the South Carolina Restaurant and Lodging Association, along with DHEC, to present these recommendations to you and Accelerate South Carolina for your consideration. Thank you.
Thank you very much.
Thank you, Bill. And I'd also point out the swimming pool portion just mirrors what came out already on Monday as well. So it follows that as well. Thank you, Bill.
Okay. Any questions relating to hotels before we move on to a couple more businesses we want to discuss? Okay. So I want to just reiterate that what we are putting together are guidelines. And so they are for businesses to look through, think through, and consider, and apply those with common sense to how their particular business operates, to the space that they have. And so they aren't all encompassing everywhere. And so I just want to point that out, that these truly are guidelines. And I think it has been said several times, but our businesses, you know, it's their livelihood, and they are taking this seriously. They are hungry for these guidelines, and they are using them and applying them to their business. So with that, I want to talk about, Zach, if you could put that one Word document back up on the screen. We do have a handful of businesses that we have yet to discuss that were named in the Governor's Executive Order 2020-18 when the non-essential businesses came out. It is a handout that you have, as well as it is on your screen. Several of those businesses were mentioned by Dwayne, either in the individual experience attractions or as he discussed that we are just starting the guidance on looking at how to open athletic fields and some loosely organized, if you will, sporting type events. So you do have, as Dwayne mentioned, you do have a very, early draft of the athletic fields, and so I would ask this group to take a look at that. We are developing and getting additional input into that from organizations who host and maintain team sports, so that is coming out there. But you can see on this list how we're thinking about these. And when we say minimal spread risk, it's kind of the same things we've been talking about is what are the different businesses in terms of do they naturally encourage kind of congregation or large groups, or are they easy to sanitize after uses? For example, playgrounds that aren't staffed, very difficult to really try to figure out how do we manage sanitization after children have used them. And so that is something that we are, thinking through. It's on the list. So you can see the list here that we are continuing to work through. Again, these are the businesses that right now we're under the governor's executive order as non-essential. And so there are a lot of other business types that we may have guidance for that remain to be open, and we are going to provide guidance just as best practices for those businesses. But for this committee's purpose, we are going to focus on these here that are listed. And so we're going to work on those quickly and get those out to you all, probably via email, depending on any future meeting that we might have. Couple things I want to call out to you. Also in your stack, you do have faith-based organizations. It's not on this list because it was something that we had discussed very briefly, and you do have it in your email, still in draft form. So it's one of those things where we are looking for any feedback on that. So that's in your stack as well. I want to call out one other thing in your stack. We also included the South Carolina Manufacturers Association did basic operations for manufacturers. And I wanted to include this as an example of something that we are going to do once we complete guidance for the businesses that are currently not allowed to be open. And what this is manufacturing, a little bit like attractions, it runs the gamut in terms of what sorts of things they need to think about, what is the layout of their facility, how many employees do they have, et cetera, et cetera. So it's very difficult to do a guidance for manufacturers. So what the Manufacturers Alliance did is just kind of, here's a list of things that manufacturers should think through as they look to continue operations or in certain cases reopen. And this is something that we went through the same process we've gone through for all the other guidance. We went through DHEC and we went through OSHA. And we will continue to do that as much as possible. And, for those trade associations, et cetera, that want something like this will be posted on the accelerate.sc.gov website. It'll be on Commerce's website, and it's also on DHEC's website. So another resource that we will continue to provide.
Jennifer, before you,
Yes.
This is James, sorry, over here. Before you move on, I'd like to touch on a couple of things that you've mentioned, just because I know we've gotten some questions about, like, earlier this week, the governor had made a decision with respect to YMCA's and gyms and pools, and that happening next week. And one of the things that was addressed, and I think that, and you've mentioned this, but I want to make sure, to the extent people are listening out there, and things regarding athletic fields, which include youth sports,
Right.
and the recommendations for youth baseball. And for all our, travel ball parents out there who are going bonkers over their young next Pete Rose not playing right now, that clearly that falls in the guidance that we're trying to get together. And frankly, we've been able to reach out to a number of youth associations. I know John Rhodes with the Continental Amateur Baseball Association and the South Carolina Youth Soccer Association, and some others have identified these things that, put into practice all of the various guidance, social distancing and kind of what the new normal would be. So I think for those people who are out there listening, that this is, clearly we see that it falls under this, and there may have been, some people may say, well, does the YMCA include all these other things? And it's like, okay, we're listening. That, I think, shows we're listening. We want to make sure we get the right guidance to them. And I'd like to speak briefly on Sarah's point about, or Sarah's, the issue with the guidance for manufacturers. And I think, look, I mean, I can't sit here and give people legal advice, but because you're not clients, of course. But nevertheless, I mean, I am a lawyer, so I think about these things. And talking to some of my law partners about, specifically some things to think about as you do these things and you carry out these best practices and guidance. If you say, hey, I'm going to do this thing, then do it, right? I mean, if you say like, hey, I'm going to wipe down all these surfaces every day and you don't do it, I mean, that could be a problem. That could be problematic. So, roger up for the things that you can definitely do. Document. That's always a good thing to do, to make sure that you've got good documentation of what you're doing, what practices that you've put in place, and what you're doing. Also, to just, each business is different. I think we learned during when Bobby presented things about restaurants, we understand that it's not a one-size-fits-all proposition, and I think they did a great job of trying to put together guidance that hopefully covers the gamut, but it may not cover every situation with one-size-fits-all. So anyway, I just say that as a point because I think, we're going to talk about liability later, and let's be clear that that's a real thing. And so we want people to be able to operate safely, and for their customers and their employees to all be able to do that. So I just wanted to make those couple of points, and then I'll be quiet now.
Absolutely. Thank you very much for that. Happy to take any comments or questions about the guidance that we're going to continue to move forward with and share with this committee as it becomes available. I think you see in transitioning to our next topic, you see on here also of great interest are day camps and overnight camps. And so we will be working with a team that will include our Department of Social Services on that. So workforce and childcare has been something that this group has talked about in several meetings, and our Department of Social Services has been doing a ton of work in this area. So I invited Director Mike Leach to join us today to talk about what they are doing, what some of the concerns are for these facilities, and then also talk a little bit about the guidance that they've developed relating to daycare facilities. So Director Leach, I'll turn it over to you.
Yeah, thank you, Jennifer. Thank you, Governor McMaster, Lieutenant Governor Evett, Chairman Burns, and the Accelerate SC response team for the opportunity to speak on behalf of DSS and share our work and what we are doing with child care agencies and all our clients across the state. So DSS serves 1 in 6 citizens in South Carolina. Adult protective services, child welfare, economic services, child care. We have been, in the last month and a half, submitting waiver after waiver with the federal government, expanding and trying to make sure that we address the needs of more citizens of South Carolina to make sure that they're able to get through this as well as possible. I also have professionals across the state who are working to help people get food benefits every single day, make sure their families are fed. We've had increased call volumes, obviously, due to the nature of the need due to unemployment. We have staff working to make sure families continue to receive needed child support payments. We have staff who are helping support child care centers. And I have DSS professionals who are putting themselves in harm's way every day, having to do face-to-face investigations for adult protective services and child welfare. We haven't stopped working. Actually, our work has increased. So we have been going nonstop through this to make sure our citizens are served as much as possible. One area that has been a focus is child care. There are some information that you guys have in front of you, but In order to legally operate in South Carolina, child care providers must maintain a valid license or registration or be legally exempt. There are 4 types of centers: child care centers, that's children, there's 13+ children in there, group homes, 7 to 12 children, and family homes, 6 or fewer children. And then a limited operations holiday care, exempt from regulatory requirements. The family members and friends entrusted to care for one's family of children by parents are not registered, licensed, or inspected by DSS. That's stuff we see every day going on. As of 5 p.m. yesterday, 1,154 child care centers have chosen to close across the state. That's 48% of all licensed child care facilities in South Carolina. The number is down from a high of 1,288, or 53%, as of 4/13/2020. Since the onset of the COVID-19 pandemic, there have been no executive orders by Governor McMaster mandating the closure of child care centers in the state. I will talk about some of the reasons that they identified closure in a little bit. We did see our largest increase in child care centers choosing to close the week following the governor's executive orders around school closures and the closure of non-essential businesses. We continue to communicate with child care centers, reaching out to them and understanding what their needs are and figuring out what are the next steps with them. We did receive $63 million in federal child care funding through the CARES Act. We received that about 2 weeks ago. We are working to make sure these funds are implemented in 3 primary assistance strategies. So the idea was, this money's coming to us, how are we going to make sure that we get this money out in supporting different areas of the child care setting? So the first thing we did was make sure that we focus on essential workers and paying for child care while they report to work during the COVID-19 emergency. So that was sort of phase 1 in this. So we received 5,287 requests for child care vouchers for essential staff and first responders. We've approved 1,869 of those. We still have about 3,000 pending. Again, workload for us has increased, and so trying to make sure we're doing our due diligence and getting through these as quickly as possible is our focus. And we've denied 331 of these requests. This accounts so far for about $9.3 million with the 1,800 requests. So we're going to see upwards of $20 million used just for this aspect of the CARES Act. And this money is going directly to the child care centers. The second primary response that we've implemented thus far is cleaning and sanitizing grants. Child care centers could get $600, license exempt facilities $400, group child care $300, and family child care homes $300. As of today, we've issued cleaning grants to 544 providers for a total of $374,000. We expect more folks asking for those grants. There is a barrier with that money, is that, are there the resources, disinfectant spray, wipes, things like that, to purchase with this money? And that is something we've heard, and I'll talk a little bit about that. We're still accepting applications for cleaning grants with scchildcare.org. That's our main child care website for parents and child care providers. And lastly, DSS is working to stand up a program that will deploy larger grants to child care centers. These grants are designed to help child care providers who have had to close or lost revenue due to low enrollments during this pandemic. We have determined the application and delivery mechanism, which will utilize a benefits portal, and we believe very easy for our providers. So we've been standing that up in the last 2 weeks. And we plan to make these funds available to providers within 10 days of approval. We believe we're going to start hopefully mid-May, so either by Friday or early next week we'll be able to provide that. Those grants will probably be between $3,000 to $15,000. And we believe that with all of that, we will be close to that $63 million of the CARES money. We continue to contact the child care centers to reach out regarding needed cleaning supplies. So we're working with South Carolina Emergency Management Department, South Carolina Commerce, and other agencies to source and distribute the PPE and cleaning supplies requested to assist our child care facilities in reopening. We anticipate having a majority of these items procured and distributed regionally over the next several weeks. You can see that we had a request for a lot of things. Facial tissue, cleaning cloths, bleach, baby wipes, paper towels, antibacterial soap, thermometers, rolls of toilet tissue to be able to support them. We focused so far with emergency management on masks, gloves, disinfectant spray, disinfectant wipes, and sanitizer as sort of the primary focus right now. And we hope that, when the need is identified, and people are aware that they would donate to be able to assist some of these child care centers in having these needed resources to get going. I think it's essential and necessary that large business reach out to their local child care centers and see what the need is, especially since many of those individuals are potentially working in those businesses and are going to struggle to come to work if they don't have necessary child care. It's going to take more than government. It's going to take that local community engagement to get involved and understand the needs and try to figure out what they're needing to make sure that their staff can get to work. We've been contacting child care facilities. We've contacted 1,215. We've been able to reach 357 as of May 12th. Sometimes they're just not answering emails or phone calls. My licensure staff aren't going out to those facilities like they were as much as possible, just because of the face-to-face component of that, and they're closed. We know that 129 plan to reopen, 69 in May, 60 between June and August, and 228 centers have not made decisions about reopening thus far. Reasons cited for this: following school schedule. So we heard that immediately when schools closed. We're going to follow that school schedule. Following governor's schedule executive orders, where we've had to say there has not been an executive order on child care centers. Waiting for parents to return to work. So my product is children. If parents are home, there are no children to serve. So that chicken and egg thing is there. We've heard will reopen when governor reopens universities. I'm trying to understand the connection on that one outside of maybe there's some child care centers on university grounds. Waiting on the boards to vote on reopening. Many of these child care centers have boards who have decided to close, and they have not reconvened to discuss that. Waiting on governor, public health leaders to decide. Waiting for COVID case numbers to decline. Are just a few of the reasons that folks have identified to us.
Director Leach, can
Yes.
I
Yes, sir.
interrupt and ask
Yes,
a
please.
couple comments and a few questions? One comment, and I'll ask her to expand on this. And I saw what I'm going to praise Lou Kennedy, and I'm pointing over at her, but I know that with respect to her employees, that she's made significant efforts from a child care perspective to make sure the children of her employees are taken care of. And I think anecdotally there may be some other, I think at least what I'm hearing is that that's something businesses look at. But I guess I would suggest that if somebody needs a model for the way to do it, just knowing how Lou Kennedy does business, that's probably a great model to use.
I agree. I think Lou is, knew the needs based on her business of what needs to happen to support South Carolina and others, and is focused on making sure her employees' needs are met with childcare. We've stood up 15 temporary child centers. Others have done that as well. But I think that's one good approach, and the other approach is reaching out to some of the other community ones locally in your county and going, what can we do to help?
And Lou, can I ask my one quick question? I'm going to turn it over to you. Is that okay? So on this, where you have 129 centers that are going to reopen, do we use the Accelerate SC website, or do we use your website to let people know? So if they need information of like, hey, I'm going back to work in Orangeburg, and these child care centers are going to be reopening. Maybe mine that I used previously is not reopening. How are we making sure that we get that information out to the citizens?
Yeah, so on SC Childcare, that is noted there, but we do need to do a better job in making sure that people are aware of who's open, where they're open. I mean, we're talking 2,419 child care centers, and we are focused on, one, just making sure that, when we have those discussions, that there is the proper safety. So on the front end of all this, we were focused on, for the ones who were continuing to stay open, the 50% plus, that we provided proper guidance on what that's going to take to make sure that they're keeping their staff and their children safe at all times. And now we're obviously working on guidance on those folks who have closed and reentering and what that looks like.
Gotcha. Lou?
First of all, if you need hand sanitizer, we're making plenty of it, so we'll make sure you're taken care of. Next thing is, I've worked in childcare before I started doing this job, and so I was very adamant about the way we would structure what we were going to do and what we would do and wouldn't do. I did want to commend DSS. They called to ask me about it. I explained exactly how we were going to handle things. And all of that just came crashing back because having been in that business before, pharmaceuticals. And so one thing we decided early on, there are a lot stricter licensing laws around diapering, so we weren't going to do infants. And we started at a older than toddler age and up to, I think our oldest child we've served has been 12. But we made sure that we're watching for peanut allergies. We've made sure that we've got adequate first aid. And then fortunately, because we have that educator program, I've had licensed South Carolina teachers working on their curriculum. And frankly, these parents have thanked us over and over because the teachers are helping the kids with their e-learning. They're bringing their tablets and stuff from home, and I think that leads to a little happier home life maybe at night. But I appreciate the cooperation of DSS when we decided to try and do that.
The other thing I was asking you, Director Leach, and so it seems like from a sourcing perspective, you're able to, or we're able to put the child care centers that maybe aren't open yet, or the ones that are trying to source some of these materials that, the collaborative that Chuck Spangler and those guys are running, because I know that oftentimes we've heard it may be, hey, look, say one of Sarah or Ted's members who have, they need to buy 200,000 masks or 200,000 of something. That's easier to source, believe it or not, than, hey, I need to get 50, right? So, I mean, hopefully we're able to close, it seems like we're able to close those seams.
So far, we have a plan in place, and I again, through the EMD, I think gloves and masks, and they're working. I know they're making contacts on and sanitizer on disinfectant sprays and wipes and those kinds of things. I mean, they're calling around vendors, and they have a really good plan in place. And we're going to have 4 distribution sites, I think, at the National Guard Armories, and then we're going to dispense from there. South Carolina EMD has been a tremendous help for DSS, not just for this child care work, but also trying to focus on trying to make sure that we get some stuff to some of our group homes and domestic violence shelters and those kinds of things. I mean, there's a need for all of these helping entities, and some things we can get through that route, and others, there's the opportunity to donate some of these things that may not be as easily accessible, or some of these businesses might be able to help. Again, get workers back into the into the workforce.
Okay.
I'd mention something on that. On masks, we now have the National Guard is set up at McCready Training Center at Fort Jackson, a machine called Battelle, B-A-T-T-E-L-L-E. It's huge. It's the size of a trailer on a tractor trailer. I don't know how much it costs, but it's a lot. And they can clean 80,000 face masks a day. And all you have to do is take it out there, ship them to them. It's being used in other parts of the country as well. So that should help with face masks.
And Governor, we, as far as other aspects of DSS, we're looking at that as far as when that's, as that's ready to go, because, we are limited, right? And we are one agency with other agencies asking for a lot of the same stuff. And, I have investigators who, we're going to have to continue to supply this for a while. And so we are thinking about how do we make sure we utilize those things.
Well, it's my understanding from the meeting this morning, it's ready to go right now. And you send them in, and they send your mask back to you. It's all carefully identified, all approved by the necessary authorities and all that. So that gives us a big head start on face masks. And also out on Shop Road, John Carrington is creating the face shields. Have y'all seen them? It's called Z-Verse. That's the name of the company on Shop Road. It's a face mask shield that attaches around your neck. It's got sort of a clip-on thing, goes around your neck, and it comes up over your face. The others go on your forehead and go down. These others are new, and they make them right on Shop Road, and they're selling them all over the country. So that's they are very easy to use, and they don't get in your way. So I would recommend anybody who's interested, take a look at them.
Director Leach, I think Ms. Hazard has a question.
Yes, Sarah Hazard with the South Carolina Manufacturers Alliance. Director Leach, 2 points. We are keeping track of a list of companies in South Carolina that are manufacturing some of the products that you're looking for. So we're happy to provide you with that list of companies and also some of the vendors that are able to supply some of the products. So we're happy to do that. And then I also appreciate the comments, the notes that you made on the number of daycare centers, childcare centers in the state that are still remain closed. It does sound like some of them are starting to open back up, but what can we do to help more of these childcare centers in the state to open?
Great question, Sarah. I think that like many, I'm focused on my 4,000 staff as well, and my group home providers and everything. And the outcome that I'm trying to get is reduced anxiety and fear about all of this, right? So making sure they're informed, they have the needed appropriate PPE, understanding their role and how to actually implement the guidelines, right? Like as we work on reentry plans within the state, how do we practice these guidelines? Not just have them on a piece of paper, but what does that look like? How do we approach that? And those are the things that I think that we have to continue to make sure that we inform them on those things. But we're reaching out, and when they identify those needs of PPE and those kinds of things, we're trying to connect with the appropriate resources. But also, I think we're focused on how do we reduce that anxiety and fear, and how are we supporting each other all in this together. So if there's a company in one county and they have 5 or 6 childcare centers, what if they reached out to those folks and just said, hey, we're in this together. We know it's hard. We have folks who are coming back. What can we do to help you and make sure that you're supported in our county as a collective impact sort of model?
Thank you. We're happy to help and collaborate in any way we can.
All right, thank you.
Lieutenant Governor, you have a question?
Yeah, this is kind of for Sarah and Tim, but what I heard Director Leach say was that a lot of daycare centers closed down because parents were working from home. But I've been hearing from a lot of parents that are working back home as it's becoming increasingly challenging to watch your children while you're working back home. I wonder if you could do a survey by the big companies that are in your associations to find out from their workers how many would be willing to take their children back to childcare, even though they're still working from home, and maybe for the next few months. And that way you can target it in areas and look out at those facilities that are still closed down to try to give them incentive that if they open their doors, parents will really come back.
Sure, we're happy to do that. Many of our manufacturing employees are still working and are looking for childcare options. So, but we're certainly happy to do that. That's a great suggestion.
A few other things is that we have continued, DSS has continued to provide ABC voucher funding to child care centers even amidst closure for enrolled children. So we've been able to keep sort of that voucher going, that money coming into that agency or that entity. And then we've partnered with, an example is Merchant Food Services, to set up 4 access points for providers across the state to obtain needed food resources at a wholesale price. So we're trying to think through different things that we can do to support them outside of maybe our normal functions that we've always done. But as you guys have talked about, it's a need, and we have to make sure that we are, getting them back into business as quickly and safely as possible. DHEC did, there is a document on here, DHEC did start a guidance document for child care facilities. The CDC does have information out there. DSS did provide sort of focused child care suggestions as far as considering changing your sign and procedures for parents and other visitors, so limiting folks coming into the centers. A lot of times, if you have children, you like to walk them into their class, making those type of changes so that, at the front door there is a drop-off and we're limiting folks from coming into the building. Limit visitors, limit communal sharing of food, again, hand washing. So we have draft guidance here. It's very similar to the stuff that we did for folks who were working to remain open this whole time. But we want to make sure that they have that, and then we're calling them and we're talking about how they're practicing that, or what are the barriers to implementing some of these things.
And since you're talking about children, and I thought I would mention this, I see my friend Rochelle Taylor from the South Carolina Medical Association is here. And one thing I've heard is with respect to, our we have a lot of physicians who may not be, directly dealing with this COVID thing, but I think there's been a lot of fear with families about, hey, for normal things, that we still have other things going on, other medical issues, right? I mean, people, break arms, they, others. Look, my wife had an appendectomy during this thing, so there you go. But our physicians, especially those with children, our physicians that are primary care physicians are again, they're still there. They are, they can look after our children, see them, and I think people should have the confidence in knowing that, our healthcare providers who may not be just dealing with COVID-19, but deal with all of the other things are there and ready to serve the families of South Carolina and children as well. So I'm kind of picked Miss Taylor out because she's sitting back there, but I just thought I would mention that PSA.
Well, and so that concludes my report, pending any further questions.
Good stuff.
Does anybody have any other questions? Madam Chair, if you don't mind,
Please.
You know what I'm about to do.
I do.
A 5-minute bathroom break, if everybody's okay, and then we'll get on.
Let me say one thing.
Yes, sir.
This is most interesting. I just want to remind everybody, as Mr. Leach said, we did not close child care centers. We had a light touch, and we restricted only what was absolutely necessary. We did not close all what other states considered non-essential businesses. We closed only a few, and that's why we're doing better than most states. We did not close manufacturers at all. In Michigan, the governor there closed manufacturing, if you can believe that, with automobiles. And that's why they're rioting up there right now. And I think they're locking people up when they come outside of their houses. They're very, very strict, and it's costing them. We did not close churches. We did not restrict churches. No, I have any synagogues or temples or anything else. We didn't touch them. There's a First Amendment, and we've stayed away from that. Although all the usual recommendations from the healthcare people about social distancing, that's available to everybody. And we didn't close hotels. We got some rules in here about it. We didn't close hotels. Now, we did for a few weeks, we had a restriction on reservations being made in South Carolina from people from 3 states, New York, New Jersey, Connecticut, and the city of New Orleans, that were declared by the CDC as for a domestic travel advisory. That is, they said, people in those states and that city do not leave those states or those cities and go anywhere. So we had a restriction on reservations for hotels for a few weeks for those people only, and we lifted that. So my point is we're doing a lot with recommendations for different businesses and industries and all sorts of things, none of which were closed or restricted. Now, there were some that were, as you know, but that's why we're coming out of this better than others. I saw a quote the other day. It said that there was a man named John Augustus Shedd who lived from 1829 to sometime. He was an author of some sort, and he said, a ship is safer in harbor, but that's not what ships were built for.
That's good.
And that's a good attitude to have in South Carolina.
That's it. Bathroom break.
Helen, can I make a point, sort
Yes.
of to follow up on the governor's point?
We're always looking
Okay,
forward to your points, sir.
And this won't take a second. My name is Henry Swink, and we have done, as a committee, an amazingly good job with outlining the guidelines that we need to follow. We've done an amazingly good job of getting small businesses and large businesses back to work. The governor's point, he didn't close down hotels and churches. But this committee is amazing to me, the recognition that it gets. At least people are emailing me, talking to me, calling me about different issues that they have. But I think there's one link that we as a committee are missing, and it's a real important link. And this link is when we got all these guidelines in everybody's mind, small businesses are reacting to them, large businesses are reacting to them. We've got them back to work, but the problem is nobody's coming like they should come. Until we get people coming back and going to these hotels and restaurants, we've still got a major problem. And I think with the recognition that this committee is having, that we as a committee at some point in time should take a publicized tour of South Carolina and go to the beach and spend a night in a hotel and go eat at a restaurant or go have your nails done and go from Myrtle Beach to Charleston to Columbia and Greenville. Not in one big bus, but maybe several buses. But I think that we've got to convince the public that we do live in a safe state. So that will do, I think, now that we've got the two things, people back at work safely, it's time for us to tell them, by George, it's safe to do it. And we're getting a lot of recognition. And if by George, they knew that Henry Swink was going to a hotel and poking the tiger in the eye with your finger, eating it up, you would start, I think we would see, I think that's the next link we need to do. It needs to be done right. We need to have Democrats on the bus, Republicans on the bus, cross-section of people, and those people are selected because they've done a good job in their business, and they get to ride with us for 2 days, or we get to ride with them for 2 days. And I think at some point in time, we need to think about that, because we have done a good job, but we hadn't quite crossed the goal line. And when we cross that goal line, we want to kick for 2, not for 1.
Yes,
And I
sir, we
think
do.
that would.
I think Dwayne and I could
Yeah,
help
say-
make those reservations.
I was thinking we could do that, Henry. We could put you in a
Governor,
commercial,
that's
as a matter of
all I
fact.
But we need to get across that goal line, and we're
Yes,
not
sir.
there yet. And it's the people who are not coming to whatever businesses you're working. It's funny. I've gone to a little part shop yesterday morning to get a part, and I walked in with a mask. And if you come in our company, you have to have a mask on. If you aren't, you walked out. I'm so used to wearing this thing, I'll go home at night and still have it on in the car. But But it's the point that I walked in this part shop, I was the only one with a mask. The guy behind the counter put his mask on. I mean, that's simple, but it's the stuff that, as a leader, we should do, and I think as a leader, we should set an example.
Thank you, sir.
That's all I got. Thank you.
Thank you, Mr.
Mr. Chairman,
Swank.
you ready for your break?
Yeah.
Oh, you know I am. Yeah, we'll take 5 minutes, y'all.
saw James run into his seat. You did a 4-4-40, James. Ooh, after I knocked the table over.
That's what I think.
I gave Henry a big shout out.
All right, if I could ask everybody to take your
Handled it
seat.
perfectly. Every time somebody asks, what do you think? I'm telling you, we got to commend him. Yeah, we all are. I've been trying to give some big shout outs.
So the next, I know the next thing we've got are business and industry liability issues, and Ted Pitts from the South Carolina Chamber and Sarah Hazard from the South Carolina Manufacturers Alliance are going to talk about that. And I think obviously Ted has brought this issue up before about, ultimately our General Assembly could take action if they wanted to be here to work and to pass some legislation. I know there's some discussions in Washington, but we'll turn it over to Ted and Sarah to talk about the liability issues.
Yeah, and I'll let Sarah kick us off. And obviously, this was a partnership. Sarah will talk a little bit about that. And we're going to have some folks from some other associations speak briefly as well. And I don't know if you want them, are they going to use this microphone? Or they can use, okay, yeah.
We can use those back
Got it.
there because they're easily, because we got two of them and we can.
All right. Thank you, James. So as we all know, the COVID-19 has wreaked havoc on our state's economy, and it's created a situation where all sectors of business and industry are facing challenges and risks to operating. So we need to promote economic recovery as quickly as possible. Public health guidelines have been issued at the state and federal levels in order to keep workplaces safe, and those guidelines continue to evolve as we learn more about the coronavirus. A key to jumpstarting our economy and reopening businesses is to minimize the risk of potential liability going forward. So that is why several organizations, as Ted mentioned, have come together, including the South Carolina Manufacturers Alliance, the South Carolina Retail Association, the South Carolina Medical Association, the South Carolina Hospital Association, and the South Carolina Chamber of Commerce, and some other organizations. And we are targeting or supporting targeted and limited liability safeguards. It's important to note that our focus is limited to COVID-19 related cases only and for a temporary period of time. So while we do know that Congress is considering liability reforms at the federal level as well, we know that we need reforms at the state level because most of these cases will be filed in our state courts here in South Carolina. So we wanted to bring this conversation today to Accelerate SC to the Response Task Force to consider as a recommendation for the governor to consider supporting. This will be something that our legislature will need to act upon, and it's not something that the governor could do by himself through executive order. We know that the legislation, or that there has been legislation and executive orders that have been enacted or are under consideration in various other states, including several southeastern states. And we also know that COVID-19 related lawsuits have already started to be filed here in our state. If we want to go to the next slide. So we are looking at temporary and limited immunity from liability for companies who are trying to do the right thing by following public health guidance to provide a safe workplace. The root cause of all of this is a disease pandemic that is out of our control. We can take steps to mitigate the impact by following recommended safety guidelines, but we don't want the COVID-19 situation to put companies at risk who are trying to do the right thing by operating safely, employing South Carolina workers, and rebuilding our economy. To speak specifically about manufacturing, manufacturers continue to operate or are restarting their operations. They are implementing extensive safety precautions as recommended by the regulatory authorities. And we have been working, as mentioned earlier, with OSHA and DHEC to develop best practice guidelines to protect our manufacturing workers as best we can in the COVID-19 environment. Some of the other organizations that are represented here today will also speak to the specifics of their industries in just a moment. But I do want to also note that the safe harbor that we're talking about should begin at the start of the pandemic and should be effective only to the end of the pandemic or the end of 2022, whichever is earlier. That is what we are considering. And then the last piece I'll mention related to manufacturing is product liability. Many manufacturers have recognized that the need for personal protective equipment and other critical supplies to combat COVID-19 rose, and so they have repurposed their operations to produce those critical products. So a temporary and limited safe harbor from liability for manufacturers making PPE is needed, except for an injury that would result from a reckless or intentional conduct. So with that, I want to hand it over to my colleagues, Krista Henson with the South Carolina Hospital Association and Rochelle Taylor with the South Carolina Medical Association to speak to their industry specifically.
Good afternoon. My name is Krista Henson with the South Carolina Hospital Association. I appreciate the opportunity to speak on behalf of all the hospitals in the state about their concerns, especially as it relates to medical liability and protections for those. Over the past couple months, hospitals have drastically changed their operations and invested heavily in testing, research, and treatment for the coronavirus to be a major player in the state's response to the COVID-19 pandemic. Hospitals are doing their best every day to work with their employed physicians and clinicians to provide the best care they can with the information available, but that information is changing all the time with new research and information about what's effective against this novel virus. The possibility also still exists that we may come to a point where we do not have adequate numbers of medical supplies to meet the demand. Fortunately, South Carolina has not come to that point yet, but I've heard from my colleagues in other states about the reality of that situation and the difficult decisions that are having to be made when there aren't enough ventilators or medications to treat all the patients who need them. I'd also like to highlight the need for protection for hospitals as they are adapting internal procedures and the use of their personal protective equipment due to shortages of that equipment and the guidelines by the CDC of conservation of that during a pandemic as they try to balance providing care to patients and protecting their healthcare workers. We would ask that these protections be extended to all healthcare facilities, hospitals, as well as nursing homes and others, as well as individual providers, nurses, and physicians. So I'll turn it over to Rochelle Taylor with the Medical Association to speak more specifically to the physician perspective.
Yes, so thank you for your time today. We very much appreciate being able to speak on this important topic. Our physicians are very concerned about the liability that comes with having to treat a novel disease. The Medical Association has over 6,000 physicians, and some are in hospitals and some are independent practices, and they're all facing different challenges from treating a disease when the standard of care changes daily, weekly. There's information we don't know. They're being pushed to use drugs that we aren't sure of or that are new on the market and trying new theories in order to keep people alive. But also, we have physicians that are closing their practices to preserve PPE or strongly limiting people coming. They're just now starting to open as the PPE is available and as the state has done a good job bringing it in. But they're looking at these problems as they are going to see lawsuits, and we're already seeing some being filed based on treatment and based on delaying care. And I think delay of care is another issue as well, as patients are scared to come in, and also physicians have flattened the curve by tamping down and closing and not having urgent procedures earlier in this process. So we think those two liability issues are very huge for physicians who are really at the forefront of this in many ways. And we appreciate the time for that. And I'd like to ask Rebecca Leach to come up to talk about on behalf of the retail industry.
Hold on real quick, Rebecca, before you talk. Let us sanitize that.
Mr. Chairman, while they're sanitizing, I think it's really critical that we start talking about the fact that it's so important that we have these protections for businesses to allow to reopen with confidence, because that's what we're lacking right now, is that confidence. And if we can get these temporary in place, I think it could help us.
So I'll let Rebecca speak, and then I've got a number of questions I'd like to ask related to this, if that's okay, but I'll let Rebecca go first.
Thank you. Thank you so much. So again, Rebecca Leach, the Executive Director of the South Carolina Retail Association. And I first want to say thank you, Governor, for your efforts and your guidance throughout this entire crisis. The burden you bear is not enviable, so we appreciate your efforts. And to you, Lieutenant Governor, for your efforts in the Complete Count Committee and your recently launched Count Me In campaign today. I think this crisis is a very a timely reminder of why responding to the census is so important. So we appreciate that. Throughout this crisis, not one retailer in South Carolina has remained untouched. And so some come in the form of having to, or touched in the form of having to close their doors, while others are having to limit their access to their stores. And then, of course, all of them who remain open are having to implement new measures and new training in order to protect their employees and their customers. Those employees that remained open throughout all of this faced a large challenge with how to navigate this as the protocols and the recommendations were occurring real time for them. And so they were having to figure out what were the best protocols, what were the best measures to protect their customers and their employees. And so unfortunately we faced that challenge, but I applaud our retailers who did remain open and who did protect their employees and their customers while they also continued to provide essential products and services to our citizens. And so that's in the light of the liability conversation, that's a big concern for our retailers. We did remain open, or a large chunk of us did remain open, to be able to provide those essential services and products to our employees. But we also are concerned with the liability and the risk that came with remaining open. And now that most all of our retailers have reopened and they have implemented the best practices for protecting their employees and their customers, that concern continues. And so again, not only does our concern lie with an employment side and an employee side of the liability spectrum, but also the exposure that maybe our customers might have experienced. And so that's a very big concern for us. We've actually heard anecdotally some retailers who are hesitant to reopen their doors because they're worried about this liability that they're going to bear should they reopen their doors to continue their businesses. In South Carolina, 1 in 4 employees work in the retail industry. So we touch a large chunk of employees in our state. And so this is a large concern for us. And this is not something, this liability conversation is not something we're doing in anticipation. I think as Sarah said, we've already seen lawsuits filed across the nation, hundreds of lawsuits. And so this is something that is something we're responding to now and that we know is forthcoming. And so that is the reason why the Retail Association and our group that we've formed here is very much in support and understands the need for this liability protection. And so with that, I'm going to hand it over to Ted Pitts for some final thoughts.
Yeah, I'll close this out and then we'll answer questions, James. So first, I just point out that we have a workers' compensation commission in the state, and it's a process that works for employers and employees. We want to clarify that COVID should go through that process, and attorneys shouldn't start trying to file suits in civil court or circuit court. So, that's we want to clarify that. And then the last thing is, this is not intended to protect bad actors. If a company is not doing what it should to keep its employees or customers safe, then they have issues, and those issues can be dealt with. But in order, like Rebecca said, in order to get the South Carolina economy moving, in some cases, businesses aren't going to open because they're concerned about the liability. We heard about childcare centers. I know the childcare business. It's a family business. There are concerns, right? What's the liability? And when you look at opening back up to generate some revenue, or the exposure that you have with litigation, there's a decision that has to be made there. And we feel like the General Assembly's got to step up and do this. We do not think it can wait till the fall. You heard the senator here a couple weeks ago say, we aren't coming back until the fall. I will tell you that's too late. Businesses need this now. They need protection now, and it's something that the General Assembly needs to act on. There is leadership in the General Assembly. Speaker Lucas, we're talking with him about looking at being a leader on this legislation, and he is looking at it, and we're hopeful that that's going to happen. And we know our leaders understand to get the economy started, this needs to be done.
So I have a few questions, and the first one is, and I think you may have answered it with respect to the speaker. So clearly, there's an understanding that legislatively they've got something to do, right? And so what efforts are they making to do something? I mean, is there a draft bill? Is there is the process where an amendment can be attached to a current bill and it's going to be germane? What efforts are they making to ensure that businesses in South Carolina are being protected?
Yes, I think we're hopeful that the speaker is looking at language. We're hopeful that that when the General Assembly comes back, hopefully this summer, that the bill is ready to go through a committee. And we understand there's been talk about it needs to go through a committee process and not necessarily try to attach to something else. So we believe that's going to happen, and we hope that it happens sooner rather than later because the business community needs it.
And so I assume that kind of y'all, this group, that between the chamber, the manufacturers, the retailers, the doctors, the hospitals, that have y'all made similar overtures to the Senate, and who in the Senate is leading the charge on this?
You know, we've talked to senators that are also interested in this. You know, the speaker has said he's interested in looking and doing the work that needs to be done, and so Sarah's had conversations as well as others. If you want to speak up, you know, we think this bill probably starts in the Senate, and starts in the House and goes to the Senate. But you know, obviously, we're open to senators that are willing to work on it. Sarah.
Yes, I would agree. We have had conversations with members of the Senate who have expressed an interest in having these conversations. The other thing I would mention is, you know, while we are kind of a small coalition right now, there have been a number of other business organizations in the state and healthcare organizations that have expressed interest in this liability protection. So it's going to be, I think, a very big conversation for our state. And as Ted said, we hope that the conversation will happen sooner rather than later because we are starting to see these lawsuits pop up.
So is there draft language? I mean, I guess what I'm asking is, like, what concrete step has been done to say, okay, look, I mean, I've got this thing, here you go. I mean, I guess that's my question.
Yeah, we've provided draft language to leadership, and they're looking at it. They haven't had it, 24 hours. They haven't had it long enough to be able to respond to us, but I think we're hopeful that that we'll get that response. And, obviously, in my conversations with the speaker, he knows it's an issue we have to address, and we're confident that he's going to help us try to address it.
Our company issued a letter of support to Washington, and we feel like it's very, very important for as Helen keeps mentioning, that confidence level. People just want to feel safe and want to do the right thing.
And this is really a small business issue. I know you look at a lot of the folks that are working on it, and the larger industry has a general counsel. They have an HR professional. They can do, paper the file, if you will, and ready to go to court. Really the small operators that are out there trying to do all they can to employ 3 or 4 people and do the job, this ultimately is something that they need more than anybody, but the entire business community needs it.
Does anybody have any other questions? Representative Hewitt.
Since I'm here on behalf of the House, I guess I'll speak for the speaker, and that we have adjourned sine die, and we can be called back into session. And I know that if he calls, I'm ready to come and take whatever steps is necessary, and I feel that members I've talked to in the House and the Senate are ready to do the same thing. So I think we'll be here for you when you need us.
Thank you, Lee. That's great.
Does anybody have any other questions, comments? Lieutenant Governor?
Just one observation on my own, Ted. What I'm seeing is that it's the small retailers, and maybe a better question, that are opening, but it's our big retailers, our big national chains that are staying closed. Is that not kind of what's happening? Because that's kind of what I see when I'm trying to kind of look around. So it's the little guys who are the ones probably most at risk right now because they are opening up.
Yeah.
Absolutely.
I mean, I think we could all agree. I mean, small businesses are the backbone of our economy in the state. And so, I mean, I don't want to speak for NFIB or anything like that, but I think clearly that our small businesses, I mean, we've got, one of our members of Accelerate SC, Chris Patterson's a small business owner, and look, I mean, I think that there's a recognition there that, again, small businesses are the ones that that really are the multiple pistons of the engine of our economy. And so I would hope that, again, to the extent that the General Assembly has to act, that they see this as important for our businesses, important for our citizens, important for our economy, to move forward in an accelerated way. So.
Yeah, and I think Sarah and Rebecca and Rochelle and Kristen, I think we would all hope that that this task force would endorse a proposal, not necessarily the language, but would endorse a proposal that would provide some limited liability protection for businesses during this this unusual time.
Absolutely.
Thanks, Ted. Do I turn it over to Helen or Jennifer? I'm looking.
Yeah, I think we've just got one thing left, right? Dwayne, you're it.
Nope, that was a holdover from another meeting, so cut and paste.
So Dwayne, you don't have anything, really?
All good. No, I'll just chime in to emphasize what Ted said. It's not just retail, it's hospitality as well. You heard Helen testified yesterday before the U.S. Senate. I mean, it's an issue for us. James, you just talked about small businesses. That's a lot of what tourism is. So it's an issue, big issue. A lot of them are concerned about liability surrounding this. That's all.
And so I guess as we kind of close out, a couple of things, kind of reminders for folks. As you've gotten, and this has been a very heavy, this component group has been very heavy in work and work products, and I know that everybody's has been sent a lot of stuff to review and has provided very thoughtful comments. And I think that, not to the exclusion of the other components who are, of course, working extraordinarily hard and doing the same thing, but a lot of what we like to call, I'll use some Navy terminology, following up on the governor, the yeoman's work has been done by this group. And I think we've got some more work to be done, and that may require maybe one additional meeting of this group before Thursday. I don't know. I think we'll see if that has to happen, and Jennifer and Helen and Dwayne will let us know. Tuesday is again our large group of Accelerate SC. Will come back together as we hear from all of our component groups. Again, I think that thankfully the governor had the foresight to put together a group that is working hard for our businesses, large and small, working for our citizens. And as we like to say, I hope that we can put Director Elsie out of business over at DO. And so that's the goal. And so, Governor, any closing thoughts from you?
I'm just trying to remember how many billions of dollars have gone through the Department of Employment and Workforce. I think it's over $1 billion now so far. So thank everybody. Appreciate it. We got more work to do.
Thank everybody, and have a great day. Safe travels home.
Are you ready? Okay. Well, we appreciate you coming. You may have been here earlier to listen to one of our committees speak of the Accelerate SC effort, and we're making progress. And there were some recommendations that were provided today, as well as insights into various parts of what needs to be done in our state. And we are moving as quickly as we can, as safely as we can, to accelerate the business work in South Carolina to get the businesses open, running, and the sooner the better. And we'll be glad to answer your questions.
Governor McMaster.
Yes, sir.
Dr. Bell yesterday said she saw maybe she estimates that only 10% of people are actually wearing masks when out in public. Does that concern you? I mean, do you agree with her? And do you think we're ready to be going back out into public again if people can't follow the guidelines for the mask?
Yeah, I do agree. I agree with the recommendations been made by the CDC, as well as our own Department of Health and Environmental Control. People need to be careful. You don't need a mask everywhere, but there are many places where you do need one. Again, we urge people to pay attention to what the health authorities say. You have to be your own doctor. We can't be policing everyone in the state, but we have given information. The best defense is a well-informed citizenry, and we hope people will be very careful. The mic just went off. We hope people will be very careful in all of their activities. Yes, sir.
There's a lot of concern about with businesses reopening, that liability issue. You touched on it today. How concerned are you that businesses won't reopen because if they become a super spreader event or something like that, they'd be liable to civil prosecution?
Well, those are legitimate concerns. They've been addressed. I know there's some attention being given to that in our legislature. I know as well nationally, both Senator Scott and Senator Graham, as well as others in our congressional delegation, are giving some attention to that. That'll be something that'll need to be analyzed, and some steps will need to be taken. Yes, ma'am.
As you'll be allowing barbershops to open and gyms to open, we know that there have been a couple businesses like Publico and 5 Points that decided to close down for 2 weeks because there were just too many people flocking to the restaurant itself. Would you perhaps be open to the idea of any sort of ramifications if any of these stores or businesses have an overcrowded population, may not be following those guidelines as you've mentioned?
What's your question is?
If you are open to any sort of ramifications, perhaps in terms of shutting down specific businesses or barbershops, if you catch them perhaps not practicing that social distancing or wearing those masks as you advise?
Well, there is still the rule, the statute that provides the police authorities to bust up or disperse crowds that are threatening public health. But there are ample guidelines for every business. There are, of course, social media, as well as customers seeking to protect themselves, have a choice to make when they go into a place. We presume that the businesses will use their best judgment in following the guidelines to be safe. But in the end, if a business does not feel comfortable opening because of their clientele, because of the kind of service that they provide, if they want to take more time to develop their own response and their own procedures following those guidelines, that is purely up to the establishment. We're not requiring anyone to open, but we would certainly like people to open, and we need to get back to business. Yes, sir.
I'm sure you were glad the General Assembly did what you asked yesterday. They passed that continuing resolution. But I want to talk about the bill you signed this morning, extending absentee voting to everyone in the state for June. Talk to me about why you wanted to expand absentee voting and why you thought it was necessary for our primaries.
Well, I had said from the beginning, of course, that is state law, and that is up to the legislature. That's not something that I could change with an executive order. So the legislature heard the needs of the people and responded, and we want everybody to vote. We have a very broad absentee ballot system in the state, and those who fall into those categories should use it. Yes, sir.
Governor, back to Dr. Bell's does that concern you that people are not being careful?
Well, yes, of course it does. And there are people that are not going to be careful. There are others that are going to be very careful. But we would encourage everyone to be careful. But again, we cannot police the entire state. People are going to have to make their own decisions, but they're leaders, they're people in businesses at every level in our localities, small towns, big cities, that can set the example and encourage others to follow the rules and be safe. Yes, sir.
Any thoughts of making masks mandatory as?
No, sir.
None whatsoever?
No, sir. Not to make them mandatory, but as you know, many businesses are requiring of their employees in hospitals and dentistry and all a variety of places that they are highly recommended and they are used. Yes, ma'am.
Also, I think nursing homes, of course, have the most vulnerable population that's affected by the
That's
virus.
correct.
And are there any sort of ways where you can find ways for family members to, I know that visitation policies will remain to be very strict, but any sort of ways where families can come?
Well, that's a new phase of this virus that we're into. Every 2 weeks or so. I mean, we've been here for over 2 months now, and as we've seen, the situation that existed at the beginning in March is not the situation that we're seeing now. This is it's like a different crisis, a different emergency because it changes almost daily. That's why these people in Accelerate SC, as well as all the agencies and others, are working around the clock to determine what we need to do and how we need to do it. But the most vulnerable among us are the older, the senior citizens, particularly those with underlying health conditions. And serious enough health condition can even cause younger people to be highly susceptible to this. So we are entering a phase now where we are going to pay extra caution and determine the best things to do to see what some other states have done concerning the elderly population, nursing homes, retirement villages, and things of those natures, and have the best guidelines that we can have. Yes, sir.
Governor, some members of the legislature yesterday seem to have concerns about privacy issues with contact tracing. So how do you balance getting dependable contact tracing to contain the virus while also respecting people's personal liberties and freedoms?
Well, again, common sense comes into play, and it is important that we be very careful. But the system that's been announced by DHEC is one that does respect people's privacy. That is, when someone is and they've explained it, but in a nutshell, when someone has tested positive, then, of course, when they are advised that they have tested positive, as they will be, then they are asked to give information as to where they've been and whom they've seen, where they have been in close contact situations, not just passing people on the street or saying hello to someone, but actually been in closer contact than that. And they're not required to give that information. Everyone's identity, of course, is protected, and I'm certain that that contact tracing will be done in the right way. Yes, and if it's not, if somebody's doing it wrong, then we'll take steps to stop it. Yes, sir.
NASCAR is getting ready to start their season up again this weekend.
I couldn't hear your question.
NASCAR is getting ready to start their season up again this weekend in South Carolina.
Hallelujah. Yes, sir.
Was there anything that your office did to convince them to pick Darlington as their first venue? And if not, do you know why they did?
The lady in black, the track Too Tough to Tame is known worldwide. And for those who've never experienced that, I would urge you to go. Won't be able to go this time because they won't be having spectators. But yes, we were in contact with the people, Carrie Thorpe, and as well as Ms. Kennedy and others about that, and gave our advice and guidance. And they are happy to be. The first NASCAR event will be in Darlington, and then be two more following, May the 17th, 19th, and 21st. And that's a good thing for South Carolina and a good thing to NASCAR. Yes, sir.
Governor, what do you say to people who have filed for unemployment, have been offered their job back, knows about it and says they're going to cut off benefits, but those people are afraid to go back to work? DEW has said just being afraid isn't enough to turn down that job if it's offered back to you. But what do you say to people who want to heed warnings and don't want to go back to that work?
Well, there's a process of the questions that asked and answered about why you don't want to go back to work. It's not just automatic, but it depends on the situation, and there are guidelines for all employers to use, and if they're not following those guidelines, if they're presenting a dangerous situation, this is a little bit related to the question of liability that came up earlier. If there's a dangerous situation, then of course nobody would be expected to go back to work. But those things have to be handled on a case-by-case basis. Yeah, but we want people to get back to work. That's the whole point of the Accelerate exercise. What we're doing, we need to get back to work, but we need to get back safely. Yes, sir. Joe?
Last night you extended the emergency or the state of emergency.
That's right.
Were there any changes to it?
Yes, a number of changes. As I say, each time each week, it seems almost each day, something new happens. There were some things that were repeated that had been used before. There were other things that were taken out. As I say, we'll be addressing different issues as we go forward. Yes, sir.
How long do you expect the state of emergency to be continuing?
Well, it's a 15 days by state law. But of course, if you have another state of emergency, if there's another emergency, or there can be extensions for the same emergency. But the state of this one is changing weekly. And what we addressed at the beginning is not what we're addressing now. Yes, sir.
Governor, I know with y'all calling it Accelerate SC, NASCAR will do that on Sunday. What conversations have you had with them that'll bring, do you know what economic benefit it'll bring the state since no fans can go? Is there a money sharing agreement? What benefit financially?
No, I'd have to verify that for you, but I know when they have all the people there, it's up in the many millions. But you have a television audience that I'm sure is productive. But again, this shows that South Carolina is opening up. NASCAR is a great event. It's a part of South Carolina, and the Darlington is world famous. So we're happy to have that happening again. Yes. Yes.
Governor, Director Parrish talked about reopenings of attractions in different phases. When do you expect those phases to start?
Yeah, those you speaking of the conversations had today at Accelerate SC, those are good rules. We'll discuss those a little bit more and then make decisions when and if to implement those, exactly how. Some of them, all of them, or maybe even some more. Yes, sir.
Governor, will you and the First Lady plan on going out to open restaurants with outdoor seating or to do anything this weekend that you want people to be safe when they go back out, but kind of set an example?
We're looking forward to it. We haven't made those decisions yet, but I can promise you we're ready to get out. I'd like to ask the Lieutenant Governor to bring us up to date on the census.
Thank you, Governor. And thank you to everybody. And so, as you know, the governor has asked me to chair the complete count census here for South Carolina. And I think what the theme that's been coming over and over in all these meetings and sub-meetings is how important the census is to getting federal dollars here to South Carolina for the needs of the state. And we talked a lot about it with broadband. Broadband and the grants that come out of the federal government are completely tied to the census. Because the kickoff was April 1st and we were under the COVID-19 pandemic, we didn't kick it off. So we've been counting on our media partners like you all to make sure that you're getting this message. We are now 39th in self-reporting, which is not good at all. We want to make sure that everybody understands why the census is so important. So the last time I gave a few comments, I want to, for anybody who wasn't here at that point, for every person that files for the census, the state gets about $3,000. If you take 100 people that don't do their census and turn it in, over 10 years, the state loses out on $3 million. A lot of money, and that's only with 100 people. So today, I'm very proud. We are releasing a video. We did this video in partnership with Senator Graham and Scott, with our Congressman Rice and Duncan. Evan McCain and Darius Rucker are part of it, and there'll be a whole lot more familiar faces. Davo Sweeney. Brian will be sending out a press release tomorrow so you can see it. It's called the Count Me In video. We're hoping with such dynamic people, they will get the message out. So if you can do your part and help us get word out to everybody of just how important the census is.
Lieutenant Governor, can you talk about, especially right now, pandemic unemployment assistance, payroll loans, a lot of that federal funding, all determined by population, what you talked about, our stockpile shipment determined by population. Connect it for people, this pandemic, your help in this pandemic, directly tied to counting the population correctly.
That's absolutely right. So the monies that we received from the federal government are directly tied to the census that happened in 2010. And per the Census Bureau, South Carolina was upwards of 20% undercounted. So it is playing part in what we're dealing with right now. We can't fix what's happened in the past, but we can definitely do better going forward. And that's why it's so important for people to fill out their census information and get it turned in. This is the first time since the census has been being taken that we can do it online. You can do it from a mobile device, your iPads, your computers, and you can go on to www.my2020census.gov. It takes just a few minutes. I did it for our household. I had it done in less than 5 minutes. So it's not hard. It doesn't take a lot of time. But we are asking, it was brought up, I was asking our colleges and technical colleges to reach out to their students and have them help. Maybe members of their family that don't feel comfortable going online, grandparents, aunts and uncles, go to them, help them log on. I know a lot of these people are in protected groups that we're worried about going out to the post office and maybe don't feel comfortable. In our rural communities, the Census Bureau does not send paper returns to anybody with a P.O. box, and that affects some of the communities that need federal help the most. So I have been calling mayors in those communities and asking them to reach out. We're partnering with our faith leaders because people may not trust government. You know, we've heard the governor say that a bunch of times, but they do trust their faith leaders. So we are reaching out to every part of the state to help us get our numbers up. Because we are not our door knockers, that's been delayed. It becomes more important than ever for us to rely on you, our great media partners, to make sure that we're getting that word out of why it's so important and why it's kind of getting drowned out in the COVID-19, everything that's going on. So we really need to bring that up front, or it's a price we'll pay for the next 10 years.
Lieutenant Governor, are you asking your partners, your faith leaders who are going out to ask people to fill out the census, who may not be comfortable with a computer or don't have access to broadband, are you asking them to bring like iPads or iPhones with them to fill it, just to have them fill it out right then and there? Exactly.
They had offered to do this in churches. Obviously, churches have kind of stopped for a little bit, and so now they're reaching out to them and helping them. And like you said, as churches are opening up, they will work with them to help them fill it out right then on the spot.
Lieutenant Governor, I know that in previous Accelerate SC task force meetings, Superintendent Spearman talked about how there's no solid statewide kind of broadband plan right now, and you guys are still working on that. Can we just follow up with you in terms of where you are on that process of more hotspots? I know that some schools have those buses with hotspot Wi-Fis, but any other parts to your plan that you would be willing to share with us today?
Governor, you want to take that one?
Sure. The broadband, the necessity and the advantage of broadband internet service throughout the state is a topic that has been discussed for years. We have the private companies are interested, the co-ops are interested, the schools are, it's been highlighted just with this pandemic how important that kind of service is. So there's an all hands on deck interest in providing that service. The thing to do is to find out the best way to do it. Free enterprise works very well. There may be incentives involved, but we want to be sure that everyone has access, because more and more things are done online, not only education, but healthcare, telemedicine, all those kind of things. So we're working in a variety of capacities to see that we expand that. Yes, sir.
Governor, can I ask you one more question? Have
Sure.
you signed an executive order to ensure that state employees are not going to have to use paid time off for COVID COVID-19 related issues? And if not, is there a plan to do that?
Yep.
You're not signing executive order, but
Oh, not-
Adams has the reentry plan.
Yes,
Phases.
that's right. Yeah, we're not covering that with an executive order, but we announced, was that yesterday? Yesterday, the reentry plan for the state employees. Yes, sir.
Governor, there is a potential tropical system off the coast, not expected to do anything to the U.S., but it is a stark reminder we're headed towards hurricane season. Talk to me about, the efforts you're taking to now handle potential hurricane impacts in the state, as well as dealing with getting a state back to work in a pandemic.
That's an interesting situation. Living in this beautiful place we do, paradise here in South Carolina. We are at meetings this morning. We're discussing the coronavirus, the tornadoes that hit early in the month, as well as a depression, a potential hurricane off the coast. And we went through this morning an exercise on reversing lanes on I-26 and various other routes to get people out and back in. So it's we live here, and this is what we deal with. But I can assure you that the people that are involved in making these decisions are highly experienced, motivated, and work very well with each other, because we've done so for so many years. And to go back to the Lieutenant Governor for a minute, this census is important for a lot of reasons, and one of them, of course, is these resources in this response, as she outlined. But also, there's a question of representation in Congress. And we got an additional seat a few years ago. We don't want to lose that. A lot of the states up where it's cold are losing population. So if we are, and there are 435 members of Congress. And so we want to be sure that that population is counted, so that our representation is as strong as it can be in the Congress for a variety of reasons.